She didn't say she wouldn't be here, but now she's not here. But that's fine. I'm sure we can manage. She'll join later.
So, hi everyone. Welcome to the weekly session. So, as always, I'm glad to open the session and see all of you here. So today we will have the short and so we will have the discussions on CEDAR localization and, as usual, access and control project, and as always, special issue updates. So I would like to congratulate all women in this team and who with the International Women's Day. So it's a pleasure to work with all of you here, and my congratulations again. So yeah, so with this, I would like to hand over to Professor Francesca, and I see that Professor Miriam is also here. So Professor Francesca, Professor Miriam, so the floor is yours. Who would like to start first?
Thank you, Aliyah. Professor Miriam has just joined us. I would like to welcome everyone and then congratulate the women of VODAN Africa. And if Professor Miriam would like to give some brief opening remarks, but in addition to the presentation on the CEDAR localization update, the access and control, and then of course on the special issue, we concluded about an hour and a half ago or thereabout the steering committee meeting for the month of March on the VODAN Africa steering committee of the FMO project. I will give a brief update of the discussions. And of course, I will also present a portion of the CEDAR, the proposal for CEDAR localization, collaboration with CEDAR. And then we had a meeting with the Ethiopian team yesterday. I will also present a brief report from the meeting. So before we go to the CEDAR localization update, I would like to request for Professor Miriam to give a brief opening remark. Professor Miriam.
Well, nothing really from my side. Congratulations to you, Professor Francesca, and to everyone. We have just concluded a very productive steering committee. And there was a lot of praise for all the work that had been done and a lot of buy-in from all of our partners. So we can all be very happy about that. And there is, in addition to what was shared, the mention of VODAN Africa by the UNESCO and the blog that Professor Francesca found through Google on VODAN as an important innovation. There was also some more news on selection of VODAN for innovation programs. Perhaps you can speak to that, Professor Francesca. So we are definitely on a very good path, and again, congratulations for all of the work that is being carried out. It's very, very impressive.
Thank you very much, Professor Miriam. Thank you for the leadership. Yes, I can actually speak on that. The past week has been one of very good news. Last week, in commemoration of the International Women's Day, the Women in Data Science organized the Kaggle competition, and the team of VODAN Africa, led by Dr. Sakinat, actually participated, and then she will be presenting the result. Out of I think 808 entries, we came out at the 93rd position. She will provide more information on that later. She has some PowerPoints. And then the United Nations through UNESCO, the 2021 engineering report listed VODAN Africa as one of the innovative projects worldwide, and especially in Africa, contributing to data production in the context of the COVID-19, and also fostering collaboration between institutions within the continent and then outside of the continent in making sure that the right and properly governed data is available for every line of responders in the COVID-19. So it is actually a big deal for us. And then a frontline journalist, I came across this in a Google alert, a frontline journalist, Mark Plout, sorry, I cannot pronounce the name well, but we shared the link already, actually wrote an article analyzing the UNESCO and picked some quotes from some of our past discussions within the team on how the VODAN Africa project is being recognized by UNESCO and how we are one of the frontline projects within the continent and region on in contributing to data production within the context of the COVID-19 and generally healthcare data, and of course, research data in Africa. The article also commended our work on the curriculum. They were excited about the fact that within the 6 countries in Africa of the partnership, and then the other countries in Europe, we also thought it best to, despite the limitation of the facilities as a result of the COVID-19, to also develop curriculum and make them available through e-learning for other countries within the region, this time I mean Africa, to also learn about our work, and of course to also train people on the fair data management in general. So this is a big deal for us, and congratulations to every one of us. We thank our technical leads, Beth, Miriam, Aliyah, and all the country coordinators and the data stewards, and say now that we have this recognition, it is a call to action to do more. Now we cannot afford to fail because we have received that recognition, and we should aim for more recognition in the future. We cannot stop the work now. We have to continue to excel. Thank you very much. Aliyah, I will hand it over to you now. I think we'll take the localization, CEDAR localization, or Dr. Sakinat, if you're ready for the presentation on the competition, because that came first. Okay, Ezekiel, if you want me to share that. Dr. Sakinat, will you be presenting, or you want me to share for you?
Yeah, you can share for us.
Okay, I'm trying to download it. Ezekiel just sent the final one. Have you shared with Aliyah or Putu earlier?
I shared with Aliyah earlier.
Okay. Yeah, while waiting, perhaps Aliyah can. Okay. Oh, that's fine then. Excellent.
Yeah. Yeah. Good afternoon, everyone. This is VODAN participation in Women in Data Science Datathon. They do this every year to celebrate the women data scientists, and we always attend the competition. But this year we attended as VODANA team, and it's usually a team of 4 participants with 50% female. So this year, the data they provided were on diabetes prediction, diabetes mellitus prediction in the data. So we will show you shortly our participation and our results, and probably some analysis or the interpretation of what our results means. Next slide. Yeah, so the participation for the VODANA team, able led by Professor Francisca, myself, and Ezekiel. Next slide. Just brief discussion about what Women in Data Science, what they do. That is actually a University of Stanford initiative to inspire and educate data scientists worldwide, but most especially they support women in the field, and they do so much more. Yesterday, they did a 24 hours conference from around 6 a.m. in the morning till the following morning, and they invited a lot of international renowned data scientists, computer scientists, women all over the world. And this started since 2015. Next slide. Most of what the women data science do, they organize conferences every year. The conference is like this, almost every country, they encourage almost every country or some independent bodies to organize this conference and probably bring in a lot of women. And it's an all-female affair. The conference, the talk, and the keynote speaker, everything is all about women in the conference. And sometimes they organize a datathon just like the one that we participated shortly, and also a podcast series. Next slide. So, and they also organize an educational outreach and also some workshop from time to time. Next slide. So, and we also, Nigeria always participates in this week's conference every year. And the first one was actually hosted by myself in 2018 at my school. That's my department, Olabisi Onabanjo University, Agoiwe in Nigeria. That was the first week's conference that was held in Nigeria. And the program was sponsored by Data Science Nigeria and Google Events. Next slide. Okay, so the datathon for this year, for the hackathon, was on prediction of the types of diabetes that could occur in persons admitted into an hospital. Next slide. Next slide. So, and the competition was held on the Kaggle, and Kaggle is a data science competition platform. They host many competitions there. So for the Vodana team now, we went as a team of 4, and the team was put together by Ezekiel Ogundepo. So he's one that put the team together. That's why his name was highlighted as you. And I was there, Professor Francisca was there, and also Sulaimon. So next slide. So the competition started actually in January 6, 2021, and we joined, and the end date was March 1st. So throughout this period, we joined as a team of 4, 50% female, 50% male, and we kept submitting our entries so that our position could be elevated. And for a full team, we usually have 50% male, 50% female. Next slide. The data set for this year contains 130,157 instances. That is rows. Then we have about 181 variables that were collected, variables of the diabetes disease that was collected in the hospital. And the task was that we should predict whether a patient has been diagnosed with a particular type of diabetes or not. Next slide. This is the structure of the data set that we're given with their different data types. All these, the columns are the variables, then the data types are on the far right, where we have the integer and the floats and the strings, the objects. So we have different types of data sets. Next slide. So for the class now, we have 2 different classes. Either the patient is diabetic or not. So, and we have more of a non-diabetic patient than diabetic patient. So from the data set that we showed earlier, now we want to be able to predict whether this patient is diabetic or not, try to build an intelligent system. Next slide. So, and when you are trying to build a model, the model is that for a positive patient, that means the patient is diabetic. For negative, it is not diabetic. So we want to be able to build a system that will give a high value for true positive and false and low positive rate. So for the true positive rate now, the patient is diabetic, and the classifier should be able to predict it as such. Then if for a low positive rate now, that the patient is non-diabetic and the classifier should predict, if the classifier should predict a non-diabetic patient as a diabetic patient, then that is not good at all. So we should have a high positive rate, true positive rate, and a very, very low positive rate. So we call this one a kind of a type 1 error. Next slide. So this is what we are trying to build, a high true negative, okay, the patient is not diabetic. Next slide, it's still saying the same thing like the other slide. This is our confusion matrix. So for the confusion matrix now, we should have a good true positive, that is the green, and the red. We should have good values for both green and red. Next slide. This is our confusion matrix. From the confusion matrix now, especially the one on the right, we could see that for the classification now, the white and the light blue, that is what we are concerned about. The result it is giving. The blue one, that is the dark blue one, and the light blue one on that's the bottom right. So those are the two good values. Then the other diagonal value are the not too good values. So we should have more of the blue one than on the white one. If you look at on the other side too. So that means that you have a high true positive value and a low false positive value. That is what this confusion matrix means compared with what we have earlier in the other slide. Next slide. So this is our ROC. This is actually the ROC value that was used to rate our submission. So what this ROC value means is that when our value, the closer your value to 1 is, the better your model. And from here, we can see that our model is 0.871, which is also a good value. And we tried so many models that we use. We tried about 4 or 5 different models before we could arrive at a good model of a light gradient boosting method. Next slide. So this is our submission. We actually made 15 submissions for different models. We have light gradient boosting method. This is extreme gradient boosting method. We also use CADBoost, support vector machine, and the artificial neural network. And from here now, we see that our submission, we use our light gradient boosting method, gave us the best results from all of our submissions. So that we have it 0.87331. Next slide. So, and out of 808 teams from the leaderboard now, the leaderboard calculated about 70%, and the private leaderboard calculated with approximately 30% of our test data. Next slide. So from the public leaderboard now, VODAN, for the public leaderboard, we were at position 59. But when they now tested with the other 30% private leaderboard, that was when we got to our position. Next slide is on the next slide. Okay, that is the link to the, no, can you go back, please? Yes. Okay, that is the link to the leaderboard. And fortunately, VODAN was at the top 12% of the leaderboard. That is the private leaderboard. And this is a good sign. We made 15 submissions and we were able to rise to the top 12%. Next slide. So that was our position. I hope I presented it. Ezekiel, do you have anything to add? Ezekiel. Okay, thank you. Thank you so much.
Dr. Sakinat, can you tell us a bit more about the data? Was the data set fair? I mean, did it have any fair component to it, the way you approached it?
We not talk about data fairness here. We only analyze the data with machine learning model. And out of all the models, we used about 4 or 5 different models, but like boosting, graded boosting method gave us the best model. But we did not talk about fairness. Actually, fairness of data does not affect the analytic result of data. So our next move now, we are moving in next phase in 2 different directions now after this competition. The first direction we are moving now is that we are building a machine learning fair pipeline where we will verify this data and also verify the model and verify our results. That's number 1. Number 2, we approached this analysis using a single label analysis, but the data is actually a multi-label data. But the competition wanted us to approach it in a single label format, which is what we have done. But we are now approaching it using a multi-label approach. So those are the 2 steps we plan to take after our special issue. So that is what the team is working towards now. The verification of the model pipeline, machine learning pipeline, and also multi-label analysis of the data.
Yes, I have seen the article in the Data Intelligence Journal. It's very, very nice. Really a great job. Congratulations. Really very good. Very, very
Yes.
good for you and the team, and nice results.
Yes, thank you, Prof. So we also welcome other potential data scientists or enthusiasts that will join us for the verification and the multi-label analysis of the data. Yes, ma'am.
I think there is a question from Wondimo. So, Wondimo, if you would like to ask a question, please go ahead.
Okay, thank you, Dr. Sakinat. I think it's very excellent presentation and very interesting. Just one question. You are trying to predict the diabetic case based on the available data, but is there a classification which contributing variable is there? For instance, in order to use that facility, for example, there are so many factors. Which one is more contributing for the presence of diabetic? And the second question is, how did you see this positive predictive value related to the prevalence of the DM or number of the cases diagnosed at specific facility? Thank you. Over.
Okay, one demo. I would still like you to repeat the second question. I don't quite get it. Now, the analysis we did here, because they used a ROC only as the metrics, but for the analysis, we have different metrics. I showed you the coefficient matrix, the true positive, the true negative. So what you are asking first is the feature importance, that which of the features, all the 181 features, which feature contribute most to the result, to the analysis. We actually have that result, but we did not, the only result the competition wants is the ROC metric results. So we did not include the feature importance. But now that we are moving to the next phase and we are completing the analysis full, then we are going to add feature importance to it. Now, maybe you can repeat the second question. Did I answer the first question well?
Yes, thank you. Yeah, you answered well. My second question is just for the public health importance. That means, the positive predictive value and negative predictive value is sometimes it's an issue that related with the prevalence of the disease. That means a number of positive, true positive value in your observation. That means that true positive value identified through golden standard. So how did you see this for the public health importance?
Okay. if I understand the question well, though I have the result for the feature importance, it's only that maybe I can post it on the CEDAR platform. That's more like us. We will see the result. Now, when we talk about the predictive values, you know, the problem that some of those models used to have, they get confused along the line. I hope I'm towing the line of the question. The thing is now, you know, we showed where we have an imbalanced data. That is also a problem why we couldn't achieve as much as 90% or more. And the reason is because some of the variables, they overlap. Like if a patient is diabetic, you know, what the doctors usually do is that they wait until the very last minute before they pronounce that this patient is diabetic or not. Or not. Sometimes when they see the features too, they wait until the last minute. So if perhaps they didn't wait till the last minute and they already said that the patient is not diabetic, but some of the features of diabetes is there with the patient. So what happens is that during analysis, the data overlap and there's no clear clusters. What I mean by clear clusters is that it is not clear whether this patient is actually diabetic or not. So sometimes the doctors wait till the end before they make their pronouncement, though the signs are there. So at the end of the day, they might say that the patient is not diabetic or the patient is diabetic. So it doesn't give clear clusters. So we still have that kind of problem. So what we usually do is that sometimes we treat this data set of these and create clear clusters, or sometimes we could remove these confusing instances so that we could build clear clusters. But that analysis now, we now try to put the analysis in different levels. The first one is that we first of all treat the data and give the data clear clusters before you build the model. So because of that, if we did that, then we will have a higher result. But because of the approach of the data on the challenge, so we have to stick to the rules. So that was why we didn't take it to that level. But now that we plan to further the analysis and give it a better result, so we are going to divide our analysis into 2 or 3 levels. We first of all treat the data set. That is before analysis. Then we analyze and give results. So Wandimu, did I answer the question?
Yes, thank you, Dr. Sakinat. That was
Yes, thank you.
one. Thank you so much. Just like you said, summary, because it is
hello.
a competition. Yes, Ketu?
Yeah, may I speak? It's actually short. So, yeah, congratulations, Dr. Sakinat and Professor Francisca. It's a really interesting result because our team have experience on working on these machine learning algorithms. I hope we can work together and expand it to further advancements. So maybe I will share you our work. We have already published 2 papers. In fact, the same algorithms, but in a different data set. So maybe Dr. Sakinat, I will email you the papers and we will try to work together. Thank you.
Okay, thank you.
Thank you very
Yes.
much. Thank you. I think I've scanned through the messages. It's just about congratulations. So congratulations to all in Ghana, and we'll continue to do greater things. Aliyah, back to you now.
Thanks a lot. Thank you very much, Professor Francesca and Dr. Sakinat, for this wonderful presentation and for this wonderful job. So I would like to give a short update on a CEDAR localization meeting that we had yesterday. So basically, we identified the tasks of each team on the vocabulary creation. So And then Mariam and her team started working on templates, creating templates. Actually, they are on the way of creating them, but then they are still identifying those templates, I guess, for different countries, if it's still appropriate for those implementation countries. And then we have received today the list of clinics and hospitals for Ethiopia. So, and we are as a team are going to work on further assignment that we will practice on John's given presentation on vocabulary creation, and then work with SCOS and Excel sheet, and try to practice with the given with the shown the presentation. So basically, and that's it. So each team have identified their own tasks and some timelines for each task. So I guess everyone will be working on their activities, and that's probably it from my side. Otherwise, unless Mariam has anything to add to this one, or maybe Dr. Sakinat. So if nothing is here, so then Professor Francesco, will we proceed with the access and control, or do you have something in priority?
Thank you, Aliyah. I think we'll take the access and control from Putu, and then we'll take the special issue before I make the final presentation on the meeting with Ethiopia that was held yesterday.
Okay, great. So Putu, I would like to give you the floor. So please go ahead.
Yes, thank you, Aliyah. I will explain short update from access and control. So yesterday we had a discussion about what is the next step of access and control. So I explained that before moving to the technical part of the access and control architecture, so we should identify stakeholders, a party with interest or is affected by the layer of access and control. Especially in layer 3 to 6, we should record how it's in the clinic's participation, and also who is responsible for what. So I split the because we should identify the stakeholder and it's each layer in different contexts. So it should be based on African countries members. So for control group, I will change the group. It's not based on, and I will announce this in our WhatsApp group. So group Ethiopia will be Getu Samson Enners, but I'm still waiting for confirmation from Professor Miriam, who will be the coordinator of Ethiopia group, because Professor Miriam told me that Wondi Muslim will be here in the Ethiopia group. And group Uganda will be Mariam, Akindele, Alia, and Sarah. And group of Zimbabwe will be led by the coordinator of group Zimbabwe group is Kudakwasi and William. And I will put the link of Google Docs that explain what we should do and what is the task description. And also next week we will discuss with Eric, because just 2 hours ago we discussed about the perspective of minimum viable access and control that we will demo. So propose a different perspective for government, for researcher, and also for the healthcare stakeholders. So we will discuss about that. But for now, we should identify the stakeholder and also the contribution of the stakeholder. Is there any addition from you, Professor Miriam?
Yeah, no, that's fine. Maybe I can just say that Wondimo is here and he can give an update on the situation in Ethiopia for the deployment. It looks very good. We had a very good meeting with Professor Francesca and Dr. Wondimo yesterday evening. Dr. Wondimo, I don't know how you see it, but I think that what is being discussed here is the technical preparation of the semantic template. So that would be Gato and Samson within the group of that's working on the Ethiopian templates. And Dr. Wandimo, I think you are leading the deployment team. So I think that is the distinction as we discussed it yesterday. Is that correct? Do I say it in the right way?
Yes, Prof. Yeah.
So Getu and Samson, they will be referring back to Dr. Wandimo for deployment, but within the technical preparation of the work that is being done with the CEDAR group led by Alia, the technical work that will be Getu and Samson for the Ethiopian templates. I hope that's clear, Putu.
Yes, it's clear, Professor Miriam. Back to you, Alia.
Yeah, thank you very much, Putu. Thank you very much, Professor Miriam. And with this one, I would like to hand over to Misha regarding the update on special issue. Misha?
Oh, hello, can you hear me now?
Yes, we can hear
Okay,
you.
fantastic. Can I share my screen again?
Yes, you can. I already give you the permission.
Okay. Perfect. Can everyone see my screen now? Yes.
Yeah, we can see
Okay.
it.
So this week has seen a lot of progress. We have received, I believe, 6 or 7 new articles, as in 6 or 7 new articles have been submitted or resubmitted. So these will then be looked at and potentially sent to Susan if everything is in order. And so on the spreadsheet, those articles, the articles where you've had a change in their status, can be seen with the yellow mark on the side. So overall, I think congratulations in order for the big progress that had been made this week. We will make sure that all the articles that have been newly received will be sent by the end of the week. Susan is also making progress. As you might see, the dark green are articles that we sent to her and that have been sent back already with feedback. So that is very good. Some final edits will be made on that. And some final edits will be made on that. And so they're expected to be soon. And then another thing that's to mention is that the articles that have not been sent in yet are all being prepared to be finalized very soon, which is also very good news. Which means that in essence, most of the articles that are on this list will be finished by either the end of the week, hopefully, or by the week after that. And we have a lot of work we can send to Susan, so we aren't gonna, we're not behind schedule, I believe. Aside from that, I don't think there's much to mention aside from the fact that everyone has done a really good job and everyone is communicating properly as well. So we have a good idea where everything is, and I think that's very important. So thank you very much.
Thank you very much, Misha. So, is there any question related to this update?
Just from me, Misha, have the articles that we are expecting from G2 and Samson, have they been integrated in this overview? The new ones, since they have arrived in Addis?
What do you mean with the new one? You mean the ones they had already signed up for, or the ones that they submitted?
Maybe, yeah, maybe it needs a conversation to be clear that all of the articles that they are working on, that they are also in this overview.
Yeah, so from Getu Tadele, I have two articles, namely 15 and 16. 15, but he's working on both of them with Samson Johannes. And one of them has been submitted, and another one he says he's in the final stages, and that it just needs to be read over once again, and then it will be submitted. So both of them can be expected probably to be sent in by the end of the week, and then we will check them and send feedback if necessary, or send them through to the editor Susan if everything is in order.
That's very good. That's excellent. And then I have one thing to report for Yeleen. Lean, there was a researcher that was sent to us by Eric, Flavia, and she knows she has been working with data for some years. And she is originally from Argentina. So I thought maybe she might be here today. She was here earlier. I don't know. I don't see her now.
I'm here, Miriam. Hello.
Where are you? You're hiding. Why do I not see you in the list? Oh, FE, that's you.
Yeah, that's correct.
Have you been introduced?
I just introduced myself in the chat, but I don't know, I didn't say anything. I didn't want to interrupt all of your presentations.
So now let's introduce you.
Okay, thank you.
Flavia has joined us for the first time. She came through Eric and we talked yesterday. So maybe why don't you say something about yourself, Flavia? And
okay.
You can put on the camera. I mean, it's
oh yeah, okay. I'm going there. Yes, I'm both. Should be. Hi everyone. First of all, I would like to congratulate you on your job. I'm just arriving here, but I see this is a very dynamic group and a lot of teamwork is going on. So that's amazing to see. And basically, I'm originally from Argentina. Then I continued my studies in Europe, originally as a psychologist. And then I bridged into neuroscience. I've been working on cognitive neuroscience, specifically developmental cognitive neuroscience, and also very much in touch with all the open science practices in verification, as Dr. Eric Schultz and Baron Mons are involved. So that's what brought me here in a short summary. So thank you for having me here.
Welcome, Flavia. I see a lot of welcomes in the chat. And I wanted to introduce you particularly to Dr. Mariam, who is here. Maybe Mariam, you can turn on your camera just for a moment. Because Flavia, she was in one of the earliest research data verification workshops, which was held in 2018, right, Flavia?
It was 2016.
Even 2016, yes. Yeah, I was doubting because I remember that one. I know when it was held, and it's really very early on. And it was so exciting. Everybody was so excited about that workshop. So, Dr. Mariam, I don't know if you hear us, but so this is really building on the expertise of making research data fair. And at that time, it was really very much at the beginning. We didn't have all of the tools that we have now. But for sure, the principles and the thinking was certainly the same. So I was thinking that Flavia could be a nice addition to the team of Dr. Mariam around the templates for research. That was the conversation that we were just having when Aliyah was speaking about the different groups. And then I also have something to say about the article on of lean, but maybe first, Dr. Mariam, do you want to say something? If that is
Hi,
okay,
Professor.
this proposal. Hi, yes.
Yes. Hi, everyone. Welcome to Flavia. I will be, or the Tunisian group will be very happy to have Flavia among our team. And we hope that we will give a more interesting work. Thank you.
I think that will be our Mediterranean group.
Yes.
Tunisia, Barcelona, Argentina. So speaking about that, it seemed, Yilin, to be actually an extraordinary possibility to expand the article on non-English language articles to the Roman languages. So Mariam, maybe it could actually be worthwhile then to follow the same procedure if one of you has time on the implementation of fair guidelines in the Francophonie, and then for Flavia to do the same on the Spanish and Portuguese speaking languages. And Yelene, I know you're so eager to finish that brilliant article, but in fact, it would really allow us to go across the globe, and for us also to really have the whole global South. So Yelene, how you feel about that? 2 new additions to your research team, Yelene.
Yes, thank you very much, Professor Miriam. Firstly, I'd like to welcome Flavia to the team, and I'm really happy to collaborate with you in terms of the Article 34, and I'm pretty sure I'm going to learn a lot from you. So looking forward to the co-working together. Thank you.
Thank you, Yelene. So on that article, I can update that I think the work on the African documentation is basically in hand with the work of Sarah and Yelene. So I think we've got that. So then you have a new group, Yelene, here. With French, Spanish, and Portuguese. You should be very careful, because you know Yelene works 2 weeks with you and he speaks more fluent than you do. His Dutch is actually brilliant. So that will be very nice to add these into that article, and then we will also process that after that as soon as we can, Yelene. So, well, that's all of that in terms of my additions to Misha's very good overview. Thank you. Thank you. Aliyah, back to you.
Thanks a lot for this warm welcoming, and welcome again, Flavia. Nice to have you in this weekly session. So with this, I would like to give the floor to Professor Francesca to give an update on steering committee meeting. So Professor Francesca, the floor is yours.
Yeah, thank you very much, Aliyah. Earlier today, we had the meeting of the steering committee, and like Professor Miriam said, we received a lot of commendation because I presented the progress report and then the revised timeline as approved by the Board of VODAN Africa, and the steering committee were really very happy with the progress that we have made, despite some of the challenges that we have faced since the start of the FMO project. And then, of course, on the part of the Go Fair Foundation that is overseeing the technical deployment, they had concerns about the localization of CEDAR, and were able to formally resolve that, and then presented the technical what we mean by the localization, the fact that the technology will be owned by the facilities and all the data entry and at the facilities level. So we received that's the basically, and then of course I had the opportunity of presenting the meeting, the Ethiopia meeting, which I will share briefly. There are about 11 slides. But yesterday we started the operational meeting with the team of Ethiopia, and Dr. Wondimu came with the head of department and some other members of the team who originally have not been members of our network. So special thanks to Obina for putting together the graphics and then the structure of the content that we have provided. So we showcase our partners and our funding bodies and supporters. And of course, we also we provided an executive summary of what we stand for, how the strategies to bring Africa right into the center of a digital healthcare management system. And of course, how we want to enhance the already existing digital healthcare systems at the different clinics and hospitals in the country. This is specific now to Ethiopia. And then with the help of Dr. Wondimu and the team, we were able to identify and receive the list of 20 clinics and hospitals across Ethiopia around the Addis Ababa area. So now we're very lucky because in Ethiopia, we have our technical team of Getu and Samson up in the north in the Tigray region. And then we have the implementation team down in Addis Ababa. And we have Dr. Araya and Dr. Wondimu who are coordinating the two teams of Ethiopia. And of course, we also presented the situation analysis, and it actually matched what they have on ground, and the manual collection of data, and then the lack of analysis of this data at the clinics, and then the lack of access to data by people in the different clinics, and then the different health workers, their inability to gain access to the data collected so they can gain more insight. So we presented that situation analysis to the team. And of course, we also showcased the expected benefit of our own solutions. We're providing an easy to use digital platform. So it makes it easy to and seamless to enter data. And then we also assure them that the data will be automatically entered into the DHIS. So we're not taking away, or we're not replacing the system already in place. We're just enhancing it to make sure the data is properly captured and made available. And of course, locally, the data will be under the control of the facility, and they alone can grant or revoke access. So they have 100% control. We are promising a real-time access to data because there will now be a dashboard at the level of the Ministry of Health for Ethiopia and the clinics and hospitals. And then of course, there will be the instant access to clinical data, and we will be working with their own data security experts, their team, and with our own technical team to ensure that all the processes of from entry to visualization will comply with the laws of the government of Ethiopia, and of course, as is promoted by the Ministry of Health. So additional benefits, there will be data protection, and of course the integrity, because the data remains in the facility. It will be stored in the facility of the generating clinic, and they also have data governance. It belongs to the country, and then they are within the framework of the Ministry of Health of Ethiopia, and they also have complete and total control of the access and security of the data. And then we presented our deployment strategy that we should have data entry through an embedded editor based on the CEDAR templates which we are creating. And of course, the data will be stored in machine actionable formats within the facilities, the health facilities. And then we're going to have the fair data points that will be managed under the regulation of the Ethiopia Ministry of Health. And we'll provide data analytics that will be the APIs. We'll provide APIs that will ensure data analytics in real time at the level of the clinics and hospitals. And then of course, present the data in a business intelligence analytics tool, where users can perform analytics in residence and independently And then we also assure them that the clinics and hospitals will have to provide their own personnel that we're going to train at no cost. So we are deploying the project for them. We are also going to train their personnel, and then we expect the personnel to carry on wherever we stop while we move on to greater things in other clinics and hospitals. And we also expect them that based on the training of trainers, they can continue the training trajectory in their facilities. They may not really need us except where very, very necessary. And if they want, the country can actually now offer fair data management as a service, because now we have the fair curriculum in the NUFIC project. So the training can also be enhanced both at the level of the NUFIC to other countries and then within the facilities. We presented our access and control, the 6 layers. We start from the data processing agreement, which fortunately the Addis Ababa University and Mekelle University already signed. And we discussed the fair equivalency work, the model that has been developed by our PhD candidates. And then of course the agreement on the template based on from the health facilities for each country, and this time around for Ethiopia, the various templates that are relevant to each clinic. Now we're going to agree with them and then create templates. That is already been done. I have shared the list with Aliyah, and then with in consultation with Dr. Wondimu and the team led by the head of departments, we'll be able to finalize on the templates, and of course with the hospital team. One fortunate thing with Ethiopia is that already there is a government health informatics project in place. So it makes it easier to collaborate more with these hospitals, because most of the things we want to do are the things that they have been yearning for. So it's going to be an enhancement or an addendum or an addition to the project that is already on ground. And then we told them we're going to reach an agreement on the repositories. It's going to be in residence, but if they want a virtual private server, that's fine, or a premise server, that agreement will also be reached. And of course, we're going to have the dashboard at the level of the health facilities, and then the generic dashboard at the level of VODAN Africa. So there's going to be the access control and security across these 6 layers. Moving on along, we presented the architecture, which we have already presented here. Flavia, you're welcome. I'll be happy to share our data management architecture with you later if I can get your email through Professor Miriam. So you also have a look. So we took time to explain how this architecture works. That has been done here on a number of occasions, so I won't spend so much time. But we presented the localization architecture for COVID-19 clinical data. And then of course, the architecture for COVID-19 research data was also presented to the team. And then finally, we presented the combined architecture for both clinical and research data. We had a very fruitful meeting with the team, and they're happy to work with us. They actually requested to be added to our platform, and I saw an exchange with Putu that they've been added to the WhatsApp platform. And I also request for Putu to ensure that the team is added to our OSF, the Slack channels, and they're included in our email circulation for our various meetings. Thank you very much. That is a report from me. Professor Miriam is the chair of the steering committee. I know we have spent 4 minutes above the time, but if Professor can also give a brief update from the meeting of the steering committee, in case I left anything out, she'll be able to fill in the team. Thank you.
Yeah, no, I think from the steering committee, we are fine. Maybe just to say that we will have a media group working on it from the different partners. So if there is, for instance, Dr. Wondimu, I can think of you. I know Golden is here from Zimbabwe. Of course, he's the comms person for the Zimbabwe team. So I can see Prof. Francesca, that we need to have a comms team. And I don't know, Golden, if you are hearing this, but if you are, I think we'd like to make sure that you are in touch. And maybe we need to have somebody from the KIU team, I think Obina, in fact, to make sure that he knows who within VODAN Africa wants to be involved in communications. And so this will maybe be another conversation. For the Ethiopian team, Wondimu, I think it would be very good if you can think of somebody like Golden from your team to also work on this with the, I don't know, what should I say, central team. Then that's one thing. Then I also wanted to say that on the architectural developments, we have identified tasks that Getu and Samson are now taking on. So with Aliyah, of course, now connecting all the different parts so that we have programmed all the parts to get ready for that timeline. And they are then also going to test some of that offline, because of course we know sometimes that the clinics will be offline and so on, so we need to know how that will work. So we are now also architecturally progressing that part as well, and of course that is coming under Aliyah. And Putu is making very good progress with the access and control group. Maybe next week we'll speak a bit more about that. And in this agreement, we also have started to look at the different functions that we need to identify in all of the jurisdictions to make sure that we have a data controller, data supervisor, all of these roles, that they are clear. Which is something that is necessary if we are moving towards the regulatory framework of access and control. So I think that's all that I have to say in addition on that for the from the steering committee, Professor Francesca.
Yes, thank you, Professor Miriam. So that will be all from me as well. Aliyah and Putu, I'll hand over to you now to close the meeting. Thank you.
Thank you very much for this update. This was a wonderful presentation, Professor Francesca, and I think if you could pass the presentation for us, this is going to be very wonderful. So with this, I would like to close the meeting and thank you everyone for joining for this weekly session. And as usual, see you next week and have a wonderful week. Thanks a lot.
Thank you. Thank you.